Hello, Triad of Health Family Healing Center friends. Welcome to our Facebook Live about hair loss. I'm kind of sideways today. I don't know if you can see me in the right direction. It's okay though. This is the new look for Facebook Live. I don't know if they told you this over there at Facebook, but right now the real trendy and happening Facebook Lives, they're always a little bit sideways. Okay, so if you have hair loss, that's not so good. As you know, as the hair loss gets more and more advanced, it becomes what's called alopecia areata. So alopecia areata, I'm just going to get a little air here, is a autoimmune disease. Not good, not fun, no way. No way, Jose. Ain't a chance, Lance. It's not going to happen in terms of being fun. It's an undesirable thing. Okay, now there are exceptions. So there's male pattern baldness, which isn't necessarily autoimmune disease. And then, of course, some people, when they become let's just say when they age to a really, really older age, in their later 80s, they may experience, some hair loss, but especially men, but maybe women as well. So I'm talking about, hair loss that's out of the norm, right? Like all the hair comes out, you're a female, let's say, and you have really long hair, and now you're going kind of bald, right? And this is really common, actually, nowadays. Oh, Yvette is watching. Hey, Yvette. Yeah, by the way, thanks, Yvette. Yvette is my wife, just in case you're curious who Yvette is. Thanks for liking. If you're seeing this on Facebook, which you might be, make sure to give us a heart, or you could give us a happy face, or you could give us a surprised face. That's a surprised face. So give us one of those. Okay, so like I was saying, the hair loss is autoimmune in nature, so it's going to be due to a major digestive disorder. There's other symptoms that are autoimmune. There's a lot of them. So like depression, cold hands and feet, anxiety, and just a low mood, feeling angry all of the time, cholesterol levels that are imbalanced, as an example, heart palpitations, stubborn belly fat, weight gain, or obesity, also called just fat, being overweight. Indigestion is the thing we're talking about right now, of course. So anyway, these are all autoimmune in nature, right? Skin conditions, dandruff, it's psoriasis and eczema and dermatitis piliformis, different types of skin conditions. These are all autoimmune in nature. So there's always going to be a digestive disorder at the core. So the other thing that we have that's interesting, sort of, is asthma. Asthma is autoimmune, not really discussed very much. Mold infections, asthma, these are all autoimmune. But let's try to stay on topic. Let's try to talk about the hair loss, okay, as best we can. So there's going to be infections in the digestive tract. There's a lot of different infections. So, but, everybody's different. So the thing that Americans especially get really confused about is they think that if they have a health problem, that there's like one solution, right? Or there's like a fix. There's like a quick fix for them, because that's the American way. And there are a lot of quick fixes in life. And sometimes, doing one thing for your health can actually make a big difference for the symptoms. But it may, by the way, if you have any questions, please ask. We can go over your questions right now on Facebook Live. So it may make a big difference for the symptoms, but it very rarely, if ever, will address the underlying cause or causes of those symptoms. So just, let me get some cross air here, pull down the windows a little bit. So as an example, let's think of an example for you. Let's say I have these really bad headaches, right? And then I start drinking some juice, like some kind of pomegranate juice or something that's like fairly freshly squeezed. I get like this naked That's a brand name. Pomegranate juice in the health food store, or some other really high quality organic pomegranate juice, and my headaches go away. So Americans are trained almost to think that, this is the cure for my headaches, right? But that's not the case. It's just that it just so happened that there was some benefit to the pomegranate juice. You may be low in iron. There's a lot of iron in pomegranate juice, and that increase in iron helped with the blood flow, and the increased blood flow decreased or eliminated the headaches. So, it's helping with the symptom, but what's causing the headaches? I mean, that's really important, is to know what's causing the headaches. So again, healthcare is all about diagnosing. You want to first diagnose what's causing the health concern. Diagnose first, then treat with therapies that are specific to that person. There should be structural therapies like chiropractic adjustments or surgery, or muscle work, which could be like massage, or we could do acupuncture. That's where you insert a needle. That's a structural. The needle is a structure, obviously, and it's inserted into the skin or into the muscle, or there's a lot of different places we put needles, but we're always putting them on acupuncture points in acupuncture. Like this is Li4 here, for example. This is related to the colon and acupuncture. Okay, I got a little sneeze. Excuse me. Man, that was a great sneeze. Maybe I should close one of the windows, huh? Okay. All right, so so let's look at the cause. So if we know what's causing the person's headaches, they don't have to be reliant on pomegranate juice every day in order to not have headaches. They can actually address the underlying cause structurally, like I was just talking about, the chiropractic, the surgery, the massage, whatever, the Bowen body work, the Rosen method, whatever. And then there's the chemical therapies, like pomegranate juice is a chemical therapy. It's nutrition. So there's herbs, homeopathy, allopathic medication, there's nutrition, there's different types of homeopathic preparations like gemotherapy, lithotherapy, which is blood components used and made into a homeopathic preparation. There's homeopathic cell salts. Schulster was the guy who developed those a long time ago. He was kind of fairly well known. There's flower essences, were first pioneered by Ellen Bach. Ellen Bach figured out actually how to get rid of the need for vaccinations by using these flower essences, and Samuel Hahnemann, who developed homeopathy, did the same thing. We now have homeopathic prophylaxis. It's a well-known thing. You can actually get the vaccination via homeopathic preparation, meaning you're not actually exposing yourself to the poisons and toxins in vaccinations. You can instead expose yourself to the poisons and toxins that are infused into the energetic homeopathic preparation, which means there's nothing in it. There's nothing in a homeopathic remedy except either sugar or water or alcohol or the inactive ingredient. Okay, looks like she has a little thumbs up. My wife's kind of got dark skin, so you can see it's like a dark thumbs up. Okay, so yeah, you can use those homeopathic preparations to get the person's titers to be raised, right? And when you raise their titers, I'm trying to give a love to something, but it didn't quite work out. When you raise the titers, then you can't you're not going to get the disease, basically. So that's the immune response, is the titers. Okay, I'm doing too many things at once on the Facebook Live. And we've been talking for a long, long time. It's been like 9 minutes, so we're going to finish up. Okay, thanks for watching this Facebook Live and tuning in. What kinds of things are going to cause the alopecia areata? Bacteria, viruses, parasites, amoebas, protozoas, spirochetes, virins, virions, things like mutations, right? You could have cancer, that's not good, but that can lead to hair loss. You could get chemotherapy, which really destroys your immune system. That's a conventional medical approach for cancer. You could get radiation therapy, also very, very toxic. These are not safe therapies, right? Chemotherapy, I'm a little more straight up now. Chemotherapy and radiation therapy are not safe because they are toxic. The radiation leaves toxic radioactive material in the fascia or the body itself, and that's been known to cause all kinds of problems with the health. Same thing with chemotherapy. May not be radiation, but it's another very toxic therapy that really kills things. But really, instead of trying to zap everything and kill it, which is what Western medicine really likes to do, why not accept that it's there and try and make the body stronger so the body can get rid of it on its own? That makes more sense to me. That's what we do in our office at Triad Health Family Healing Center. I'm a fan, obviously, of my own work. Okay. Like, what would you expect me to say, right? It's like, no, it sucks. It's terrible work. The Triad Health Family Healing Center, don't go. Okay, if you're seeing this and you know somebody you think could benefit, especially if they have alopecia, make sure and share it with them, okay? And, share this with your group of people. Share this with your people, okay? So share it on Facebook. Maybe you could share it in other places. Share it on Instagram. The other thing, like our Instagram page, please. Our Instagram page is Triad of Health. Our YouTube page is Triad of Health Family Healing Center. And, we like emojis too, if you want to give us some emojis. Just don't give us like the angry face. That's like not nice. If you do that, that means like you want to make an enemy or something. That's not good vibes. You know what I'm saying? Okay, thanks so much for tuning in, and we'll see you at the next Facebook Live. Over and out. So yeah, you got to have somebody diagnose, if you have alopecia areata, I know, going back and forth. You want to have somebody diagnose exactly what infection you have, and then you want to have specific, effective therapies that are focused, right, and really rapid, that can be done quickly, that'll get rid of that infection safely in a way that honors the body and doesn't do harm, right? So first do no harm means don't give prescription medication. The main calling of the physician is first to not give medication, according to Dr. Osler, the fairly well-known medical doctor from, I guess it was the late 1800s, very late, if I'm not mistaken. So, and the most important calling of the physician is to first give no medicine. The other thing, Kent, the famous homeopath, said, the doctor who's chosen himself as a patient has chosen a fool for the patient, meaning you don't want to try to treat yourself like all these Americans are doing, going into the health food store, whatever it's called, a vitamin store or a food store that sells vitamins or nutritional supplements or something like that. I'm right outside one of these kind of stores right now. I mean, that's where we all go shopping at. Don't go in there getting your own stuff or asking the $5 or $30, whatever, $10 an hour employee, hey, what do you think I should get? How does he know or she know? Because they're not a medical doctor, right? So they're not a licensed chiropractor. They're not a licensed homeopath. They're not a licensed naturopath. There are some exceptions to that, actually, to be honest with you. But in general, don't do that. Okay? Glad we had this little discussion here. Okay, we'll see you guys on the next Facebook Live. You'll have to excuse what I'm wearing. I just went running. So thanks for tuning in. Over and out. Peace.